On your health, managing diabetes in the modern age. For many people with diabetes nowadays, monitoring blood sugar can kind of feel overwhelming still.
More than 4 million people living with type 2 diabetes in the UK, and 1 in 3 of us with raised blood sugar levels that
Most people think type 2 diabetes is mostly about bathroom marathons, gaining weight, feeling lethargic, but sneaky symptoms hide in your skin, mouth, and even your eyes, fooling everyone, including you, for years. Doctors spot these red flags early, ignore them, and you're playing blood sugar roulette. Today, I'm going to reveal the 3 weird warning signs that could save your health and maybe predict whether or not you have diabetes. Stick around because you definitely want to be aware of these signs. Hi everyone, my name is Dr. Amy, and on this channel we break down medical science and explain complex health topics in simple language without the confusing medical terms. The goal is to help you better understand your body, your health, and the science behind medicine. This channel is for educational purposes only, and the information I present here should never replace personalized medical advice from your own physician. So if you're experiencing health concerns, always talk to a qualified healthcare professional in person. Before we talk about the unusual symptoms, it's important to briefly understand what type 2 diabetes actually is. Type 2 diabetes occurs when the body becomes resistant to insulin, the hormone that allows glucose or sugar to enter your cells and be used up for energy. Over time, 2 major problems develop. The body becomes less responsive to insulin, and the pancreas struggles to produce insulin to compensate for this malabsorption of the insulin. As a result, blood sugar levels, they remain chronically elevated in the blood. And we know that persistently having high glucose levels can slowly damage many tissues in the body, including your blood vessels, your nerves, the eyes, the kidneys, and even the skin. And sometimes these changes lead to some symptoms that seem completely unrelated to blood sugar. The first unusual sign is something called acanthosis nigricans, or AN. This condition causes dark, thickened, velvety patches of skin, most commonly around the neck, the armpits, the groin, and sometimes the knuckle area. Many people assume that this is simply due to poor hygiene or skin hyperpigmentation, but in many cases, it's actually related to insulin resistance. So when the neck starts to look suspiciously like a very expensive leather bag, that's not normal. And here's why that happens. When insulin levels in the body become chronically elevated, which often happens in early type 2 diabetes, insulin can stimulate certain skin cells to grow and multiply faster than normal. This leads to the characteristic darkened and thickened patches of skin around the areas that I mentioned. So the neck, the armpit, the knuckle, the groin area. For many patients, this is actually one of the earliest signs of insulin resistance, sometimes appearing decades before the diabetes is even diagnosed. The second unusual sign is something many people would never associate with diabetes: frequent infections. People with poorly controlled blood sugar often experience recurrent skin infections, recurrent urinary tract infections, slow healing wounds that tend to get infected because they're not healing quick enough, fungal infections such as a yeast infection. So basically, you can think of it as sugar is kind of like the bacteria's playground. They love it there. So the more sugar there is, the more bacteria will arrive. If you feel like at this point you're on a first name basis with every antibiotic in the pharmacy, then I think it's time to check your blood sugars, right? But why does this happen? Why do people get such repetitive and hard to treat infections? Glucose, like I said earlier, creates an environment where bacteria and fungi can grow more easily. At the same time, elevated blood sugar can also impair the immune system. So it's not just that you are now a bacterial peachtree dish because of so much glucose in the body, but also the glucose kind of impairs your immune system. It slows it down, and it makes it harder for the body to fight off these infections. So not only are you getting recurrent infections, they're also getting harder to treat because their immune system is also dampened a bit. This combination means infections may occur more frequently and take longer to heal, obviously. In fact, recurrent infections are some of the reasons why doctors decide to test a blood patient's glucose levels in the first place. The third unusual symptom is blurred vision. Many people assume that worsening vision simply means that they need a pair of new glasses. But in some cases, it can actually be related to blood sugar changes. And here's why that happens. When glucose levels rise significantly, the lens of the eye can temporarily swell due to changes in fluid balance. The swelling alters how light is focused onto the retina, leading to temporary blurred vision. And the retina is where light focuses in the back of your eye to transform what you're seeing into images. Interestingly, this symptom can fluctuate. Someone may notice their vision becoming blurry for a few days or weeks, and then improving again once blood sugar levels stabilize. However, if diabetes remains untreated for long periods of time, high blood sugar can eventually damage these blood cells in the retina, and that's a very famous and known condition called diabetic retinopathy. It is one of the leading causes of vision loss worldwide. The reason these symptoms are so important is because type 2 diabetes often develops silently, and many people ignore these symptoms because they don't sound like it's a diabetes symptom or doesn't sound like a dangerous chronic disease, which is exactly why videos like these matter. This is why, as doctors, we pay attention to the weird stuff, not just the textbook stuff. Back to diabetes. The best thing you can do is implement lifestyle changes, such as improving your diet, increasing physical activity, achieving and maintaining a healthy weight. And these can significantly improve insulin resistance and insulin sensitivity. In some cases, guys, it can even reverse early type 2 diabetes. So it's very important that the lifestyle should be the first thing that people look at if they want to prevent the continuation of these early diabetes symptoms into actually full-blown diabetes. So, to summarize, 3 unusual signs that may suggest underlying type 2 diabetes include darkened skin around the neck or armpits, frequent infections, blurred vision. These symptoms don't necessarily mean someone has diabetes, of course, but they mean that there might be some important clues that the body is struggling with blood sugar regulation. And recognizing these signs early can make a huge difference in preventing long-term complications and even treating it. If you found this video helpful and want more evidence-based medical explanations without the confusing medical terms, consider liking this video and subscribing to the channel. Let me know in the comments which diabetes symptoms surprised you the most. And I'll see you on the next video.